So treatment for this kind of thing, manage the pain with NSAIDs, indomethacin, I believe is the one of choice, and then you might have some kind of autoimmune medication to calm that system down to where it stops attacking your body so much. Legg-Calvé-Perthes disease. We don't know why this happens. Can anyone see it in this picture? That one right there. So that's kind of nice. There's the growth plate right through there. But on this side, yeah, it looks like it's all pockmarked. It looks like it's all fractured apart. You've got an osteonecrosis in here. So something is disrupting the blood flow. We don't really know what causes this. It doesn't typically require surgery. So as long as we can manage it, watch it, back the kid off from what they're doing, unless it's severe pain, they don't even mandate bed rest. So it will heal as long as we kind of keep our eyes on it. But stiffness that restricts movement of the hip, knee pain, limited range of motion, persistent thigh or groin pain, shortening the leg or legs of unequal length, wasting the muscles in the upper thigh. So they're going to coddle it, cradle it, not use it much because they've got aches and pains throughout. And if we can kind of identify, then rehab can fix. Anybody see it there? What joint? What are we looking at?
Ankle.
Ankle. Good. So you've got tibia, fibula, there's your talus through here, calcaneus sticking out down below. So where's the problem?
I'd have to compare it bilaterally.
Nope. Not good enough.
Looks like it's a little bit.
What's that? It's in the talus.
Was that fraction?
That dark spot right there. Osteochondral lesion in the talus. So it's osteochondritis dissecans. The bone is dying underneath. Could be from a trauma, could be from an unknown etiology, we're not quite sure. To fix it, we typically go in, remove the chip, we might need to drill a little bit or do some cartilage replacement to help that articular surface. Depending upon the source of the cartilage, that's going to give you differences in long-term outcomes. Arthritis may be an issue later in life. But unrecognized, something like that can lead to degeneration. The joint's going to become dysfunctional. We're going to have a bigger problem as long as that perpetuates. It's certainly painful and certainly limiting normal activities. Osteomyelitis. Osteomyelitis is an infection of the bone. So this typically happens in the shaft of the bone with the kid. So this is obviously a hand up through here, and that fuzzy area is an infection within the bone that leads to bone death. They used to think this is something that couldn't be treated. We now have the capacity to. So with a long course of antibiotics, we can help. You can go in and shave down because you'll end up getting an extra bone formation in and around the shaft. So they can shave that back down and then use antibiotics to clean up the infection that's present.
How do you prevent that?
We don't know. So a lot of these
I mean, some of them, this is why it's the weird section. Some of this stuff, you can get it in the long bone of like the shin, like multiple repeated traumas to an area can cause that softening and the infection to get into place from the hematoma that's present. If it's a cut or something that allows the infection to get in from an external, then you might have either way. It's, a previous exposure to like staph or to certain illnesses that we normally get can lead to this secondary to them having a systemic infection elsewhere. Ankylosing spondylitis. We're talking about narrowing and restricting of a joint surface. And so where the joints kind of fuse together, there's a whole list of issues. So again, this is kind of a bit of an autoimmune where the body's attacking itself and destroying itself to where it's fusing these bones. You can get, the name of it, spondy, is going to be referencing the vertebra. So when they start fusing together, then you start getting losses of range of motion. But other issues can have, I mean, you're going to see early morning stiffness, stooped posture. Secondary, you're going to see weight loss, fatigue, fever, anemia. So there's a systemic problem going on beyond just the pain of where the degradation is occurring. And then Reiter syndrome is another autoimmune disease. It's a connection of arthritis, urethritis, and conjunctivitis. So there's an infection or something going on systemically that's causing a flare-up of arthritis. So there's an infection in one location of the body that then creates arthritis within a joint. And so as soon as the infection gets cleaned up, cured, then the arthritis tends to self-resolve. So it's usually kind of strange. Gonorrhea can actually cause that to where you'll get an arthritis showing up in a joint secondary to the infection, the systemic infection. So, shoes. If you go barefoot as a child, if you compare Americans to other nationalities, there are differences in our feet. Seemingly, you can get a thickening of the plantar skin to as much as 1 centimeter because your body reinforces the tissue to handle the stresses that we have, walking on gravel and so forth to help prevent the problems. So does it cause an issue? Well, any of the research, we still get excellent mobility, we still get a variable arch height, we still have, and then we end up with an absence of most common foot deformities. A friend of mine once told me the problem with Americans is that we're born in shoes. We always have been, hands down. We're always in shoes, always in shoes, always in shoes. And so you end up with a lot of foot problems. So to lose all your common foot deformities, that means that we start losing things like hallux valgus. So you have somebody whose big toe, that metacarpophalangeal joint on the big toe bends way over. That's very painful, very problematic. The surgery kind of breaks the bone, resets it, realigns it. But if we go and take a shoe that opens up the toe box that can take away some of that pressure, boom, we lose a lot of that pain almost instantly. And those shoes exist. You see them more so now than you have in the past 5 to 10 years. So there's issues. We don't really have time to watch the cute video, but it's kind of comparing a toddler wearing slippers which have no arch support or no support at all to a toddler wearing Nike shoes that have more built-in support. And there's differences in foot height, their control. If we're taking away all of the sensation of your foot on the ground, then we're taking away all the neural response that you have to knowing where your body is in space on the ground. So it's interesting. And then we're going to end real quick on child abuse, because working with pediatrics, you have to be able to recognize, or at least if you suspect, you need to pass along that information. Most perpetrators are between the ages of 20 to 29. 45% of perpetrators were male and 53.6% were female, which is, all of this is scary. And then 81%, it's someone the child knows. It's somebody who's around them. It's an anger issue. It's something going on. It's stress in the household. It's stress from not having money to pay the bills. Regardless, we have a whole series of kinds of things that are indicative. Chip fractures, where if you take a kid and yank and you pull them too hard, it can actually rip off a piece of the corner bone, much like you see here. So it's actually ripping off the metaphysis off the epiphysis. So the end of the bone off of the shaft. The spiral fractures, there's a rotation if you're grabbing and twisting. Multiple fractures, especially if there's bilateral, or if you have multiple healing stages, so you have multiple fractures but they're healing at different times, meaning that they're getting a new one before the last one's healed. So there's something going on that's kind of creating the scenarios. Epiphyseal separations, again, yanking somebody to the point that you're separating those bones or causing a trauma. So, and then certainly a complex skull fracture. But warning signs of physical abuse, frequent injuries, unexplained bruises. It's always watchful and on alert as if waiting for something bad to happen. Shies away from touch, flinches at sudden movements, or seems afraid to go home. Wears inappropriate clothing to cover injuries such as long sleeve shirts on hot days. So be aware, especially if you're working with kids in high schools, kids in the underage groups, that this is a big issue, and since we are medical practitioners, we've got the capacity to see things that maybe wouldn't otherwise be normally seen. So our intervention, trust that kids may very well build that bond where they are relying upon you to help intervene on some level. And if you're acting in good faith, in terms of you strongly suggested you have reason to believe it, and you pass that along to authorities, you are absolved of risk of civil suits from that. Because you're doing what the law expects in terms of identifying and safeguarding kids. Yes, ma'am?
What about if we have like a child that comes in and they complain that their parents are abusing them, but the parents saying that there's discipline?
It's not your decision, you know? I mean, it's not our place to get involved, really. We're not trained for that, we're not the authority to step in. The idea is that if we have a concern, we can pass that on to protective services. So that they can then have the interviews that they need to and kind of try to work through some of those things. Because there is a difference between discipline and abuse, and that's their call to kind of figure out those subtleties. Because